Hey guys! Sort of change of location today. My sister is using our house as her practice studio. She's a musician, so it was way too loud to film there. It sounded really good, but it was way too loud. And so I'm hanging out at my friend's house, and she just asked me about what it's like having a disability and having all of the doctor's visits and more specifically the doctor-patient confidentiality. And so I was telling her about it, and so I thought, well, that might make a good video, and so I thought I would tell you about it. So I'm 20, almost 24, and so I've been going to doctor's appointments alone for like 3 or 4 years now. That said, I, over the age of 18, would bring my parents into the different doctor's appointments, and that was because they needed to, they felt they needed to know, and I felt they needed to know about my medical situation, and they had questions, and I had questions, and it's good to have a second set of ears, in case you get information that you're not necessarily expecting and you're dwelling on that and you're not hearing all the rest of the info they're trying to give you. An issue that can come up with that is that, well, the doctor will sometimes forget who the patient is and start talking to your parents when they really should be talking to you, and then you're talked about in the third person when you're sitting right there, which for anybody is really awkward. So for persons with disabilities like CP or any other ailment, it's you going through it and you want to be recognized as that, and you want to make your own decisions. So as I've grown up, I've figured out, I guess, how to advocate for myself in certain situations, right? There are some things that, even still, I'll get my parents to take me to the doctor, and they have this rule that if they come, they have to be in the doctor's appointment because they are not used as a taxi. But that's just my family dynamic for you. And I have asked them to leave before, so that I could talk to my doctor alone. And that usually ends up in a family discussion afterwards because they feel that they shouldn't be kicked out of my doctor's appointment, but the fact is that it's my doctor's appointment. And the other thing that I will say for persons with disabilities in particular is that you know your body better than anybody. And I think persons with disabilities, persons with ailments, just anybody, you know that, right? So if the doctor is recommending something that you don't feel you need or want, or you would rather try something else, don't be afraid to ask for that. And I know, especially if you have a disability, doctors can take your medical knowledge as nil. Well, I can tell you that that is not true. I think that's sort of why I make CP videos and try to watch as many different CP videos as possible, is because I want to educate myself on my situation and all the different aspects of it, so that when they ask me about something, I can respond in the best way that I know of with the information that I have gathered. So it's in that way, if you educate yourself about what you think might be going on, like if there's a procedure coming up or whatever, or you think you might have, say, strep throat, and they're saying, no, it's just a regular sore throat. If you don't diagnose yourself, because that can be, like, dangerous. Be mindful of the fact that they are doctors, and yes, they are doctors, but they can be wrong. I have had several awesome doctors, and I've had a couple that I just weren't the best fit for me. But either way, they all have taught me how to stand up for what I know my body to be, and for the things that I want. So, couple of quick tips. I used to journal everything, like just regularly for everyday life, and then I would, if there was a medical thing that popped up, like, oh, I was extra spastic on this day, I would flag it in a certain color sticky note. I color code, yes. That's me right there. But then I would take my journals into the doctor, and I would say, okay, the notes, the pages with the blue sticky notes on them are for you, and they can, look and see exactly what you were feeling in that moment, because you might only see them once a year for like 20 minutes, if you're lucky, right? So when they say, well, what did your seizure from 6 months ago, what did it feel like? I don't know. I can barely remember what I had for breakfast, right? So having those things just there for you can also help you and just give you a little more, like, backing to some of your arguments, as well as making a list of the things you know you want from your doctor. Like, recently I went in and I knew I needed a specific prescription filled. I knew I wanted to talk about a specific issue, and I knew that I needed a referral to a different doc, like for something else. So I sort of wrote that all down on a list in case I forget, because, like anybody, I get nervous in doctor's appointments and whatever. I don't like being in hospitals. So if you have it all written down on a list, you're not going to really forget anything, and you're just going to become a lot more organized, and you'll get more out of your doctor's appointment. So those are just a couple of my quick tips on how to talk to your doctor, whether you have a disability or an ailment, or you just are afraid of doctor's offices. And all of my social media info is down below. And I am gonna go to my friend's house right now. Okay, bye.